Welcome back to our special edition of Great Day Louisiana. As many seniors and families of senior citizens know, sometimes you need to go and see a specialist. And here at JenCare, they have many specialists here who are ready to serve you. Joining me now again is Dr. Stephen Youngblood. He is the medical director of the Kenner location. Welcome back to the show.
Thank you, sir.
Thank you so much for being here. Love the nurses station, looking good. What's also looking good is the specialties that you all have here at JenCare. You essentially have 3 of them. What are those specialties?
So we have cardiology, we have acupuncture, and we have podiatry.
Very cool. And why did you choose to pick those 3 as the specialties?
Well, for cardiology, your body needs your heart. I would say that the nurses station is the heart of our centers, absolutely.
Shout out to them.
But the heart is the biggest area of disease for most of our seniors. So we wanted to make sure they had good access to cardiology, easy access to cardiology. So when they come here to see their primary care doctor, they can just turn around and see their cardiologist same day. And those 2 can work together to better manage their diseases.
Podiatry, cardiology, and the 3rd service is acupuncture. Why do you all offer acupuncture here?
One of the largest complaints that patients have when they come in is pain, arthritis, back pain, etc. The acupuncture has been shown to be a very safe, non-opioid way of treating pain. It keeps patients functional, it keeps patients happy, and they can come in once a week and get this service done.
And I know you all specialize in these 3 specialties, but what's great is that you all work with outside hospitals as well, right? To help with different other specialties?
Absolutely. We have relationships with all the hospitals, all the 5-star hospitals that are around, Ochsner, East Jeff, West Jeff, Thoreau, Baptist, LCMC, Tulane. If they're in the area, we have a relationship with them.
And what are some of the other different specialties that you can go to those other doctors for?
So if we have to send a person outside the clinic to see another specialist, we have access to, as I like to say, all the ologies, endocrinology, oncology, gastroenterology, and so forth. If a person needs subspecialty care, we have access to that. We handpick all these individuals, all these groups, to make sure that we're getting information back into them so we can really quarterback that care.
Which is great because at the end of the day, when you're able to work with these doctors in unison, you can still get that JenCare difference.
Absolutely.
One of the great things that you all do here is you really have that relationship with the patients. One thing that you all do here that I think is really cool is love calls. Tell me about the love calls.
Yes, so we, during our downtime, which isn't much, but when we have it, we call all our patients. We try to call each one once a month. But we do have a small subset of perhaps some of our more sicker elderly patients that we may call as much as once a week, just to touch base, making sure their needs are being met, making sure they have no problems, so that we can proactively reach out to them and meet their needs, their health needs, some of their social needs as necessary.
Amazing. Is that something that y'all do whether they're coming in person or at home?
In person or at home. Whether we do video visits with them or they come in or a mixture of both, we call them via traditional telephone at least once a month.
I love that. And let's talk a little bit about coming into the actual facility to be seen. We talked a little bit earlier about the at-home options that JenCare has. If they want to come into a facility, we know we're going through a pandemic right now. What are some of the things that you all are doing to make sure not only the patients, but the employees are staying safe?
Our motto here is to be ludicrous safety. Ludicrous safety. That's what we preach to each other. And it's all about, we check temperatures at the door, we ask questions, we make sure everyone is 6 feet apart, we all wear masks, the staff wear masks. We answer the same questions when we come in. We get our temperatures checked every time we come in.
It is amazing. As you can see, everyone is wearing a mask. They are here to serve you, everyone. Because like it says, they are here for the patients. Do not forget there's a hotline that is happening right now. The number to call, 504-684-7572. Call that number if you have any questions about JenCare right now.